Okay, so we are going to go over IV insertion. First thing is you want to make sure that you have gloves on. So make sure you put on a pair of gloves. You need your IV start kit, your T connector, your saline flush, the Cavalon no sting barrier film, your IV catheter, and panties if you're going to offer some panties to the patient. So if you open your IV start kit, you have your tegaderm, your tourniquet. So, as I said, you may not always use a tourniquet when you're inserting an IV, but it's not a bad idea to use the tourniquet when you're assessing the arm to find your spot. So I have the tourniquet on, and I'm looking over. If you make a C with your hand, and you go follow that up, C for cephalic vein. That cephalic vein runs along your arm all the way up to the shoulder. So that's usually a good vein to look for. A lot of people have nice cephalic veins. And then if you just get used to the anatomy, there's veins, other veins in the forearms we should be looking at. You should never be looking in the AC unless absolutely necessary, or in the upper arm. Or in this inner wrist area. The inner wrist should be in here, should be off limits. Okay, so I'm assessing. This vein looks nice and it's really compressible, feels a good size, so that's going to be my vein of choice. So now I'm going to activate the chloroprep, which I'm not going to do on the dummy just because it takes forever to dry on the dummy. And then I'm going to clean my skin. So up and down, back and forth for at least 30 seconds. Basket weave pattern, up and down, back and forth, anywhere where my tegaderm's going to sit. And it takes 30 seconds to properly disinfect the skin. So I will either look at the clock or I will count in my head to make sure that I have done it for at least 30 seconds. So once we've done that for 30 seconds while it's drying, then I'm going to set up my T connector. So for teaching purposes, I'm just using air. I'm not using saline because it's hard to see a blood return. It gets diluted when we use saline, but in a real person, we would have a saline flush. You would express out any air, prime the saline through, and then that would be ready to go. You can get your tegaderm dressing ready, your Cavalon no sting barrier, and then get your IV catheter. So again, you want to use the smallest gauge catheter needed. Get your IV ready. If you were going to use the panties, so you would offer the panties, that goes right before you stick the patient, because it only lasts for about a minute. So you spray it up to 10 seconds or until the skin blanches. So you spray it right before you insert your IV catheter. Put a finger on each side is the best way to stabilize it. Some people put a finger up here, which is okay, but just be careful that if your finger slips back and hits the button, you're going to retract your needle, and then you're going to have to get a new one. So you'd have to poke the person again. Some people get concerned that the IV, when they push the button, the needle isn't going to retract. Apparently there have been a few instances when that has happened. It has never happened to me. So they want to loosen this up, and it's okay to twirl it around, but you can never go up and down on the shaft of your needle, because you risk damaging and putting a hole in the plastic catheter part. So never go up and down, only down around. Then create traction with your non-dominant hand. This thumb should be out of my way. I do see sometimes people trying to insert the IV over their thumb, but if it's a really shallow vein and you're coming in at a relatively low angle, you risk then hitting your thumb and contaminating your IV catheter. So just make sure your thumb is out of the way. You tell the patient, little poke here, 1, 2, 3. Advance your needle slowly, and as soon as you see the flash of blood, then you can advance it maybe a millimeter more when you've leveled off your angle. Make sure that the plastic's in the vein, and then thread that over your needle. And once the plastic is in the vein all the way, then you retract your needle. You don't want to pull it out because then you risk potentially poking yourself with the needle. Drop off the tourniquet, hook up your saline flush, flush it a little, and then you can pull back a little. You should be able to get a blood return in most cases as long as you have a 22 gauge or larger. 24 sometimes won't give you a blood return, and then give it a good flush and then clamp it. Okay. And I usually have a pillow under my arm so I have a nice steady works area. Then you get your Kevlar skin no sting barrier off. And again, I won't put it on, but it goes around the edges just to create a barrier film to protect the skin. And then your Tegaderm goes on. And the wings of your Tegaderm should be going underneath your T-connector. Again, to create a barrier between the T-connector and the patient's skin so that they don't end up with a pressure ulcer. Okay? So once you've got that, you just peel this away. And again, on the mannequin it doesn't stick as well as it does in a real person. And then this piece goes directly over and pinches around here so that it's actually both a dressing and a securement device because it's actually helping hold that in place. Then you have, you put your initials, you put the date, and again you need to put the date so that everyone knows when it's been 7 days that this dressing then now needs to be changed. And I will put the gauge on there as well. Gauge sizes have been standardized now, and then all companies make their 22s, you know, a light blue, and pinks are a 20. But sometimes it's hard to see what's underneath your dressing, so if you put it on there, then it's obvious for everybody. Okay, then make sure you tape it well. I usually put a piece here just so that they can't catch this little piece on anything and happen to pull out the IV. And you put another piece here again because you want to stabilize it so it's not moving around a lot. Because if it's moving around, then there's risk of phlebitis from that just moving around and rubbing against the intima of the vein. And there's also risk of them accidentally pulling out the IV. Okay, and that's it.